Hi, this is Dr. Karen Reluccio, Public Health Officer and Deputy Director for Health and Human Services Agency, here to give you a COVID-19 update. Normally, this is something that I would do in a Board of Supervisors meeting, but we do have packed agendas for the month of April, and therefore I am recording this to give updates. So first of all, I want to start off with the CDC community level. At this point, Napa County is in low levels, which is good news. And the basic guidance is to continue to stay up to date with vaccines and to get tested if you have symptoms. If we look at what has been going on throughout the state of California in terms of the Omicron surge, you could see here based on the slide that the blue peak was on January 4th of 2022, where there were over 155,000 cases across the state of California. And if we look at our daily case trends in Napa County, our peak was on January 4th, where we had about 2,400 cases on a single day. If we look at our case trends per week, we did have this demonstrates once again that our peak was in early January with 2,390 cases recorded in a week. And if we look at our weekly case trends, there has been a demographic shift where we have seen more whites infected with COVID-19, including those over 65 years of age, which was reflecting what was going on in our community with congregate setting outbreaks. In terms of hospitalizations, our peak was in early February, where we had 32 hospitalizations at a time that exceeded last winter's surge. But as you can see here, our hospitalization levels have gone down and remain stable. And our death trends have demonstrated a peak of 5 deaths, which is half of what we saw last winter, and it is continuing to level off. So, and if we're looking at our metrics, we had 4 new cases per 100,000 population per day, a testing positivity 7-day average of 2%. And if we look at our health equity testing positivity, or areas where the Healthy Places Index is at the first quartile, it's at 2.6%. We currently have 4 outbreaks as of the last reporting week. And then we have a case doubling time of over 2,000 days, which is good news. Our hospital capacity looks good with an ICU bed capacity of 32%. And then hospital capacity at 53% and ventilator capacity at over 90%. Last week, there were 2 hospitalizations, and 2 weeks ago was 1 hospitalization. And then last week we had no deaths recorded, and 2 weeks ago there were 2 deaths. In terms of outbreaks, you could see that compared to our peak outbreak, which was in January, we had 122 outbreaks. In the month of March, we had 20 outbreaks. And then so far in April, being midway through, we have 6 outbreaks. We're no longer reporting school outbreaks or exposures as these are tracked at school district websites. We, at the current time, we have 4 congregate setting outbreaks and 1 workplace outbreak. If we're looking at our hospital short-term forecast, things look favorable, at least for now, that they will continue to be stable, hopefully into May. So I do want to talk about the BA2 subvariant, which is in the same family of Omicron variants that we've seen over the winter. So in the winter, we did see BA1, and now we are keeping an eye on BA2. So as you know, the BA2 sublineage is 1.4 times more transmissible than BA1. However, it seems to be similar to BA1 in respect to severity of illness and vaccine effectiveness. BA2 is projected to be the dominant Omicron sublineage in the United States, particularly in Region 9, which California belongs to. State wastewater surveillance and modeling estimates suggest that BA2 is increasing in most regions of California. However, we have not seen an increase case rate in California with seeing BA2 more prevalent in our communities. In Napa County, our public health lab has sequenced BA2 in 24% of the samples that were submitted for whole genome sequencing. So this is something that we're continuing to keep an eye on. So in terms of vaccinations, the doses administered in Napa County are over 331,000, which has gone up by about 1,500 since the week before. And the total doses administered in Napa residents is over 282,000. We've seen more increases in those doses administered, mainly due to the second booster, which I'll talk about later. So overall, 90% of eligible Napa County residents have had one dose of vaccine. 82% of eligible Napa County residents are fully vaccinated, and over 77% of all Napa County residents are fully vaccinated. And then if we look at those that are not yet vaccinated, we have about 10.2% not yet vaccinated, 8.5% partially vaccinated, and then 6.8% of those that are fully vaccinated and not yet booster eligible. At this point, 64.5% of all eligible Napa County residents are boosted. So we can see the impacts of vaccination in terms of cases, hospitalizations, and deaths. So people who are not fully vaccinated are 53% more likely to test positive for COVID-19, 94% more likely to get hospitalized for COVID-19, and 96% more likely to die of COVID-19. And if you can see the graph here, the upper red line are the weekly infection rates among those that are unvaccinated, which does exceed what we've seen for fully vaccinated and boosted. If we look at the hospitalization rate among unvaccinated, fully vaccinated, and boosted, the top line is unvaccinated, so we're seeing more hospitalizations there. And then those that are fully vaccinated are in dark blue, and those that are fully vaccinated and boosted are in light blue. Where we see a lot of the impact is in death rates. So the cumulative age-adjusted death rate among unvaccinated is 10 times what we see for those that are for death rates for fully vaccinated. I would like to discuss some guidance that has recently been published, and this is new quarantine guidance published by the California Department of Public Health. So in general, there is no more quarantine for the general public, and the only situation where there is quarantine are for high-risk settings, which I'll describe in subsequent slides. So if you have an asymptomatic person who is exposed to someone with COVID-19, and this applies to everyone, regardless of vaccination status, then they should be tested within 3 to 5 days after last exposure. And close contact should wear a well-fitting mask around others for a total of 10 days, especially in indoor settings or when near those that are at high risk for COVID-19 disease or severe COVID-19 disease, including hospitalizations and deaths. Now, persons that are infected within the prior 90 days do not need to be tested, quarantined, or excluded from work unless symptoms develop. So in general, people who are exposed, if you're unvaccinated, you're strongly encouraged to get vaccinated. If you're eligible for a booster, please get boosted. And if symptoms develop, then you should test and stay home. And if the test result is positive, then you should follow the isolation recommendations that are listed in the hyperlink on the bottom of the slide. The other thing that has changed with quarantine guidance is that the CDPH has changed the definition of a close contact to someone sharing the same indoor airspace for a cumulative total of 15 minutes or more over a 24-hour period during an infected person's infectious period. So this no longer accounts for being within 6 feet of someone. Now I'm going to talk about quarantine guidance in high-risk settings. And these high-risk settings include emergency shelters and cooling and heating centers, healthcare settings, local correctional facilities and detention centers, homeless shelters, and long-term care settings, and adult and senior care facilities. So the rules here are different. So persons who were exposed to someone with COVID-19 and our staff, so this is just to delineate that the next 2 slides are really going to be looking at staff and residents of high-risk settings. So I'm going to start with staff first. So if you have a staff person who is unvaccinated, incompletely vaccinated, or else they have not been infected with COVID-19 within the prior 90 days, it is recommended that these staff be excluded from work for at least 5 days after the last exposure. The work exclusion can end after day 5 if symptoms are not present and a test is done that is negative for COVID-19. Now, if the staff person is unable to test or choosing not to test and symptoms are not present, then work exclusion can end after day 10. Of course, it's important for these staff persons to comply with CDPH masking guidance, especially in the indoor setting, as well as they're being strongly encouraged to get vaccinated or boosted. Once again, if symptoms develop, then these persons should stay home and test as soon as possible. And if the test result is positive, then they should follow isolation recommendations that are in the hyperlink in the bottom of the slide. Now, for residents of high-risk settings, if the resident is unvaccinated, incompletely vaccinated, or else they have not been infected with COVID-19 within the prior 90 days, residents should quarantine for at least 5 days after the last exposure. And this can end on day 5 if they have a negative COVID-19 test. Now, if they're unable to test or choosing not to test and symptoms are not present, then quarantine should end after day 10. And once again, masking guidance should be adhered to, especially in the indoor setting. So this is an area where residents of high-risk settings are going to have to be under quarantine. In addition to the changes in the CDPH quarantine guidance, Cal OSHA is also going to have some proposed changes that are going to take effect in May of 2022, and these will be voted on by the Occupational Health and Standards Safety Board on April 21st. So the general idea is that the Cal OSHA emergency temporary standards will align with CDPH's new isolation and quarantine guidelines and CDPH's close contact definitions. Additionally, COVID-19 tests may be both self-administered and self-read only if another means of independent verification of the results can be provided, such as a time-stamped photograph of the results. So this is less restrictive than what is in our current emergency temporary standards. And then employers are not required to provide testing to cases infected with COVID-19 who tested positive for COVID-19 within the last 90 days. So this is another change. So for K-12 schools guidance, there's been a change there. So schools may consider permitting asymptomatic exposed students, regardless of their COVID-19 vaccination status or location of exposure, to continue to take part in all aspects to K-12 schooling, including sports and extracurricular activities, unless they develop symptoms or test positive for COVID-19. It is strongly recommended that exposed students wear a well-fitting mask indoors around others for at least 10 days following the date of the last exposure. Exposed students, regardless of COVID-19 vaccination status, should get tested for COVID-19 within 3 to 5 days after last exposure, unless they had COVID-19 disease within the last 90 days. So the bottom line is there is no more quarantine. So all the mask on mask exposures or no mask versus no mask exposures, that is no longer in effect. California Department of Public Health has also published a safe and smart events playbook. And this playbook is really for events such as concerts. It could be graduations for schools or assemblies, weddings, etc. So this safe and smart events playbook recognizes that COVID-19 will remain with us for the foreseeable future and provides best practices for event operators to produce safe and smart live events. In general, outdoors is lower risk than indoors. Events where attendees are vaccinated or tested negative for COVID-19 prior to entry are always safest. It's important to train all vendors and staff working in the event on protective measures and protocols in place, including how to properly wear well-fitting masks with good filtration. And then this playbook also encourages all persons, including staff and attendees, to monitor their own health and to stay home if sick or if they have symptoms. So this playbook has checklists for event organizers and attendees. So SMART stands for shots, masks, awareness, readiness, and testing. And within each of these categories are guidance that the state provides, including resources that are available in the hyperlinks. This has checklists. So it defines guidance for specific settings. It has checklists for event operators and checklists for attendees on what the safest way to have an event is. Now I'm going to move on to vaccination and testing. So as you know, the FDA expanded its emergency use authorization, and CDC also authorized this, that individuals may receive a second booster dose at least 4 months after the first booster dose. And this applies to people that are 12 years of age or older who are moderately or severely immunocompromised, people 50 years of age or older who are not moderately or severely immunocompromised, and people that are 18 to 49 years of age who are not moderately or severely immunocompromised and who have received the Johnson & Johnson COVID-19 vaccine as both their primary series and their booster dose. So people that are in that category should receive an mRNA vaccine. Now I'm going to move on to testing. So you may have heard that the US government has launched a nationwide test to treat initiative. And at these locations, people will be tested for COVID-19. If the person tests positive and treatments are appropriate for them, they may receive a treatment prescription from a healthcare provider. And these medications, which are antiviral pills, treat COVID-19 and are free of cost. There is a test to treat locator that's available in the hyperlink on the slide. And California Department of Public Health is identifying additional sites in California. So at the current time, Napa County does not have sites, but it is a work in progress as the state tries to convert our Optum Serve sites to test to treat sites. So there are also treatment changes due to the predominance of the Omicron BA.2 subvariant. So the FDA revised emergency use authorizations for sotrovimab because of decreased activity against the BA.2 subvariant. So due to increases in BA.2, sotrovimab is no longer authorized for use in California and other regions in the United States where BA.2 is a predominant variant. So now the number one choice, or the predominant choices are for Paxlovid, which is number one choice, and then followed by remdesivir. And then bebtelovimab, which is a new antibody that was authorized by FDA through an emergency use authorization, and molnupiravir, which is an antiviral, are alternate treatments if there's medical contraindications for the first two treatments. Now I'm going to move on to testing for Medicare beneficiaries. So the US Department of Health and Human Services announced that more than 59 million Americans with Medicare Part B, including those enrolled in the Medicare Advantage plan, will have access to over-the-counter COVID-19 tests approved or authorized by the FDA at no cost. And these beneficiaries may receive up to 8 tests per calendar month from participating pharmacies or healthcare providers for the duration of the public health emergency. Last but not least, I am going to talk about public health transitions because as we get to a steady state of COVID-19 disease, and the fact that we have a lot of tools in the toolbox to respond to this, we are transitioning. So first of all, we are prioritizing case investigation and contact tracing for high-risk settings and continuing outbreak investigations. So we are no longer doing individualized case investigation or contact tracing. We're continuing to promote layered prevention strategies, including masking, testing, ventilation, self-isolation, and self-quarantine, and reducing the frequency of COVID-19 dashboard updates to 3 times a week. And much of the state is transitioning to a respiratory surveillance that's similar to influenza, but we're not quite there yet, but we are transitioning. Additionally, we're trying to increase the numbers of people who are up to date with COVID-19 vaccinations and boosters. as well as targeting prevention strategies to the most vulnerable persons, populations, and settings, including testing, distribution of higher quality masks, and early access to treatments. We're continuing to support our healthcare partners by monitoring hospitalizations and supporting them to maintain the capacity to treat all patients, as well as allocating treatments to healthcare providers and to inform the public about treatment. We're also supporting our high-risk congregate settings and preventing and controlling spread of disease within their populations by providing technical assistance with testing and vaccination, and providing guidance for treatment. So at this point, we will be responding to subsequent variant surges by riding the waves and using the tools in our toolbox. We are all very familiar with the mitigation strategies within our toolbox to slow down the spread of COVID-19 and to prevent impacts or hospitalizations. So for any questions, please refer to our website at countyofnapa.org or email us at coronavirus@countyofnapa.org, or you may call the call center at 707-253-4540. Thank you very much, and thank you to all of you for doing what you can to protect our community against COVID-19.